Hello, hello. We are back with another conversation. This time it is with Dr. Laura Hendricks of Clackamas and Oregon Pediatrics. And we're going to talk
Hello.
about all things newborn and baby care. So, before we start, would you just share a little bit about yourself?
Yeah. So I'm a pediatrician. I work at Oregon Pediatrics. I've been there for about 5 years. And like a lot of you, I am also expecting. I am about 31 weeks, and this is our first baby. So
So
we're very excited.
exciting. Yeah. And plus, you know all the inside scoop on all the newborn stuff once baby's here. So you're a good person to talk to about everything. We're talking mostly to people who are pregnant or have recently had a baby. And I thought it would be great to get a pediatrician's perspective on some of the things that parents should know, some of the ways that they can prepare before baby gets here. So, do you have some advice that you usually give parents or that you give them, early on when they first come in to visit you?
Well,
I realize it's a big question, but
yeah, a lot of people ask me about products, and I have to
Uh,
tell you that before I was an expecting mom, I had no idea how many products are out there, or the plethora of products.
yeah.
So, first of all, it's very overwhelming, and even as a pediatrician, I feel that way. So, I understand. But I do have some medical products that I could
Yeah.
recommend for you. And I'll just go through a couple of them. But one product that I recommend to all of my families is called the Frida. It's a snot sucker.
Yep.
It sounds pretty gross. You actually take a tube and you suck out your baby's snot with your nose. It has a filter, so you're not actually getting anything in your mouth. But one of the number one questions I get as a pediatrician for newborns is, why is my baby congested? Are they sick? Do
Hmm.
they have allergies? And it's just normal for babies to be congested. And they're obligate nose breathers, so they have to breathe through their nose. So to help them breathe better, if you can get that snot out, it really helps. And you'll use it when your baby's sick later on, because every baby will get some sort of cold within the first year.
How long are they required to breathe out their nose? When does that change?
It changes gradually at about, I think it's about 1 to 2 months.
Okay. Yeah, that's cool. I didn't know that, but I love that product. I've used it before. It is pretty fantastic. Do you have other, not necessarily products, but products are great too, recommendations for parents who've just brought a baby home?
Um, yeah. So first of all, I think one of the number one questions I also get is, you know, uh, how can I take care of this baby? And I hear a lot of anxiety and stress from parents from having a new baby, and who allowed me to bring this baby home,
Yeah,
right?
that was
Or
one of my questions for you. Is like, what do I do now?
right, exactly. So I have to tell you that every single parent feels that way, and it is totally normal. And the good news is that everybody does great. So even though you feel like like there's no end to this, and that you're going to feel very overwhelmed, and it's a huge life change, it will get better. And my best advice to give to parents is to stay confident, trust your instincts, and trust your love for your baby.
Yeah, that's good advice. Let's talk practically speaking. What could or what should parents expect as far as pediatric visits in those early months? What is sort of a standard setup of care? What could they kind of plan on? Did they need to do anything on their end as far as making appointments, or how do they know how to kind of set up the first couple months of baby's medical care?
Yeah. So your pediatrician, when you make that first appointment, and you come in for that first appointment, which is right away, it's typically about a couple of days after you leave the hospital. So they should outline when you're coming in for your next appointments. But it's pretty standard across the board in most pediatric offices. In my office, we do a newborn visit, which is when the baby is about 3 to 4 days old. And then we do a 2 week visit, then a 1 month visit, then a 2 month visit. So you see your pediatrician a lot. And we do that because it's important to monitor growth and development of the baby. After 2 months, we'll see you every 2 months until after 6 months, then it turns into every 3 months. And we follow the CDC guidelines when it comes to the vaccine appointments as well.
Yeah, so those fall on those sort of standards set every 2 months, every 3 months, depending on where you are in the timeline there. The vaccine visits are scheduled in. They're not
Yes,
separate visits.
exactly.
Yeah.
So,
Okay.
yeah, if you come to your scheduled appointments, that's when you'll be due for your vaccines.
And gosh, I guess I've had plenty of kids and been to the pediatrician plenty of times, but I hadn't really calculated out that that's a lot of visits over the first, let's say, year.
It is a lot. Yeah. So it's
Yeah.
important that you like your pediatrician.
Well, that takes us to our next question, which is how do you find a pediatrician that you like? What should somebody be looking for in a pediatrician or a clinic? What kind of advice can you give?
So the good news is that you can meet your pediatrician before deciding. And most offices will offer what's called a courtesy visit. And so you call the office and you set this up. And nowadays, everybody's really doing telemedicine. So it makes it really easy that you can meet your pediatrician from home and ask all the questions that you want to ask and whatever is important to you.
So as a pediatrician, do you get calls like this regularly? I didn't actually know that was something you could do.
Yeah, we do. We do it all the time. And the most common questions I get at that first visit are things like, what are your hours? Do you have weekend hours? What's your availability for same day sick appointments? Because if your baby's sick, will you be able to see your pediatrician or will you have to go to an urgent care? I think also just having a conversation with somebody and seeing if you click with that person can mean a lot because there's, like I said, lots of appointments. You want to make sure you like the person. You also want to make sure that you feel comfortable asking questions. There's, a lot that is going to be very new, and you want to feel like you're able to ask whatever you want to ask.
Yeah, you want to be comfortable. That's for sure.
Right.
So we've talked a little bit about sort of the basics, how to get set up, some of the products that parents might want to look into, and I'm curious about what of some of the common sicknesses or issues that crop up regularly with new babies at home. I don't want to scare anybody, but I just sort of want to get out there. Like, what are some of the things that you see regularly and that are kind of a normal thing that parents might run into early on?
Right. Well, I like to actually go over some of the normal things that
Uh-huh.
parents get nervous about. And I actually try to go over a lot of that in my first visit. But there are so many things that happen to babies that don't happen to adults that it's hard to cover everything. But rashes are so common
Mm.
in babies, and almost all of them are normal. So they can get heat rashes that look like little bumps on their chest and their back. They can get something called neonatal acne, which is just
Very
kind of makes
familiar
your
with
baby
that.
look like they're a teenager, and
Yeah.
and that's okay. And there's nothing that you can really do about it, and it will go away. Other common questions I get are eye movement. So their eyes will actually cross sometimes, or one eye will kind of look wonky and look to the side, and that's because their eye movement isn't very well developed yet. And that actually happens after about 1 month. They're able to track and watch you. But before that, that scares a lot of parents. They want to
Yeah,
make sure
yeah,
that
you're saying where like one eye goes. That's the
one
part that
eye can
is
like go off the
that
side.
just normal to see. Yeah, okay. Uh-huh. Yeah.
Yeah, exactly. Because
Uh-huh.
they just have weak eye movement. Spitting up is very common in babies. All babies have a little bit of reflux, and that just has to do with their anatomy. They have a muscle, it's called the pyloric sphincter, that just isn't well developed in babies. And so you're going to get different degrees of spitting up. And again, most of the time, it's completely normal. Um, what else? Oh, the umbilical cord. I get lots of questions about
Oh, I
that.
bet you do. Yeah, it's a
Yeah.
crazy thing.
Yes, it is. But so that usually falls off at about I would say 1 to 3 weeks. Once it does fall off, you just want to sponge bathe the baby actually before it falls off. Once it falls off, then you can give your baby a regular bath. But when it falls off, sometimes it can smell funny. It can have some little bit of light yellow discharge, healing fluid, and that's all just normal stuff.
Yeah, actually, I think every single thing you mentioned, I encountered with my own babies at least once, if not multiple times with all of
Yeah.
them. So that, I mean, obviously they only have one umbilical cord. So
Right.
but the rest of it is all really familiar. And it's true that when you're kind of in the trenches there, it's a little bit like, what is happening and why? And I don't know, and so on.
And you're sleep
And
deprived.
well, on top of that, yeah, you can your decision-making abilities are a little bit, struggling, I guess, let's say. And then
Right.
what are just some of the common, ailments that you see kids for? I guess now my kids are a little bit older, so I'm thinking about, like, strep and those kinds of things, but that's less common in newborns, isn't it?
Yeah, in newborns, the main, I would say the main ailment that we treat and watch is jaundice.
Mm,
And so every baby gets a little bit of jaundice, but some babies will get more jaundice than others. And jaundice is caused by something called bilirubin, and it's released by your red blood cells, and it causes the skin to look yellow in color. So it's a really normal process for babies to have a little bit of jaundice. And almost every baby will have a little bit of some yellowing in their eyes, which is also a normal finding.
mhm.
And that will actually, it'll rise until about 5 to 6 days old, and then it decreases. So, but sometimes in babies, it'll get too high. And in those babies, we do have to treat, and we do have to monitor for that. So that would be sometimes blood work, sometimes we have a skin monitor, just depending on what's going on. But that's a very common thing that happens in newborns specifically. Because you're right, we don't see a lot of colds and coughs in newborns.
Yeah.
Usually it's not until daycare, and then you'll get
Right.
one. Then it's
And then
once
it's
a
an
month.
onslaught. Yeah, and then it's yeah, all making up for lost time there, I think, a
Right.
little bit. Right. Okay, well, I guess so this might be too big of a question, but if you had just as a you've seen so many babies and you've worked with so many families, if you just had some piece of advice besides, you've got this and you trust your instincts, which is excellent advice, but so hard to listen to when you're
Oh, I
Googling at
know.
2 o'clock in the morning.
Right.
What kind of advice might you give parents who are about to have a baby or just had a baby?
Well, I think a lot of that anxiety and stress comes from unsolicited advice from other people. And so I would say it's really important that you do what's right for you and your family, and keep in mind that there's not one way to raise a baby.
Yeah.
And there's lots of different variations in the way that you raise your child. There's lots of different ways to feed a baby. You don't have to breastfeed. You can formula feed if you want. It's up to you, whatever is right for you and your baby. So I would definitely keep that in mind. The only person I would say to listen to is maybe your pediatrician, but I'm a little biased.
I
um,
think it's valid.
right. But even baby books that you buy will have conflicting advice. I actually have been reading some of them, and I'm like, oh, I don't know if that's true.
Oh, it's so interesting. Yeah. Wow.
um, but actually, the best place to get accurate information is a website called healthychildren.org. And I really like this website because it's backed by the American Academy of Pediatrics. They release new articles all the time. You can search online for any question that you might have, and it's going to be up to date, accurate information. So don't go on blogs. I did that once just to kind of see what my patients were looking at, and it's very scary.
Yeah.
Some of the
Yeah.
advice that people give. So really, when it comes to listening to other advice, make sure that it's accurate. Go to this website. There's really anything that's backed from the American Academy of Pediatrics, is going to be a great source, and it's going to be accurate.
Yeah. Okay, that is excellent advice, and we'll be sure to include that website for everybody who's been able to tune in. So, last question is, if people want to find you or more about Clackamas and Oregon Pediatrics, I know you have multiple clinics throughout Portland, right? So, where could people find out more, and where are the clinics?
Yeah, so we have actually 5 clinics. So I work at the Northeast office, which is in the Providence Portland Medical Center, or that's called the Providence Plaza. But our largest office is in Clackamas. We have another office in Meridian Park, and then we have one in Happy Valley, and we just opened a new office in Oregon City.
Awesome. And I think the website is OregonPediatrics.com is what I want to say. And actually, there's a couple listed, but I know that that one will get you there. So,
Right. There
um,
are, our team has, I think we have a couple different ones that will lead you
yeah. Yeah.
to
Yeah. Well, we'll be sure to include at least one that'll definitely get you
Right.
there. Okay. Thank you so much for taking some time out to talk with us and share some of your expertise. So we're so excited for you and your baby on the way.
Thank you so much. I appreciate that.
Have a good one.
Thanks, you too.